What can you do? What can you do right now? What can you do right now to change your career and start doing what you thought you were going to be doing when you got to this point in your career? So I've said it a lot of times. Your problem as a new grad or a student or even an experienced clinician, the root cause of your problem isn't you. It's not insurance companies. It's not a mill that you work for or a physician that you work for. It's not any of that stuff. The root cause of your problem and your limitations is what PT school did to you, or chiropractic school did to you, or athletic training school did to you. It's academia that got you in the position that you are in now. And now that you're starting to understand that, because if you think about it, the reason why insurance companies are paying less is because they know if we're talking about physical therapists, physical therapy doesn't work. Go read the evidence-based practice. Study after study after study will tell you that PT doesn't work for low back pain. It doesn't work for epicondylitis. It doesn't work for plantar fasciitis. It doesn't work for shoulder impingement. It doesn't work for any of that stuff. Now, if you go through and read those studies and actually look at the methods, it's not physical therapy that doesn't work. It's the methods that they were using that they call physical therapy that don't work. Stretching didn't work. Joint mobilizations didn't work. Joint manipulations didn't work. E-stim didn't work. K-tape didn't work. Ultrasound didn't work. Massage didn't work. Medication didn't work. It's those things that didn't work, and because we were taught how to do those things, and you walk into any PT clinic in the country and you see those things are called physical therapy. So it's accurate that those studies can say that physical therapy doesn't work because we were told by school that that is physical therapy and that's what we should be doing because physical therapists do X, Y, Z, and that's what's expected. And that's what patients ask for. And that's what physicians refer people to physical therapy for. So that all comes from the education model. And then everything else feeds into it. So I've said this over and over again. I've already said it once in this video. It's not your fault that you are in the position that you are in, because up until now, you didn't know what the problem was, what the root cause was. You didn't know how to treat it. You didn't have any options. Now, after you watch this video, and if you've been watching my videos for a long time, then the problem becomes you. It becomes your fault because you were given a solution to the problem and you said, I can't afford it. I don't have time. I don't really get it. I'm really not that uncomfortable with what I'm doing. I'm just going to keep on doing it. Okay? So it's the education model feeding into the insurance model and all the other stuff that feeds into the model that you are in that got you here. But I'm going to tell you how to get out. So if you choose not to get out because you think you can't afford it, which you can, because you think you don't have the time, which you do, or maybe you're just not that uncomfortable, which is totally fine. But don't blame anybody else but yourself after you watch the video. So if I gave you a solution to the problem that negated everything that the education model started. So we get to the root cause, we figure out where the education model failed you, where the holes are in your thought processes, we fill those in. We teach you how to apply critical thinking, which nobody has done, even though your PT school might have said, this is critical thinking. Trust me, it wasn't. We're gonna teach you how to become a critical thinker, which is going to help you start taking apart everything that you learned and putting it back together in a different methodology. We're gonna teach you how to do that. Then we're gonna teach you how to apply all the things that you never learned how to apply in school. Neuromuscular physiology is gonna be the #1 thing. So after we go through a module of teaching you critical thinking, we're gonna teach you how to apply neuromuscular physiology in the clinic. You've already solved a huge portion of your problem right there. Then we're gonna follow that up with how to effectively screen your patients. So now you're getting away from the symptom modification model and you're getting to the functional model. So if you don't get away from the symptom modification model, guess what you do? You do all of those things that all of those studies have shown doesn't work, and then that's why people can say physical therapy doesn't work. So when you understand why cupping and needling and K-tape and stretching and foam rolling and manipulation and heat and ice don't do anything to get to the root cause of your problem, and some of those things actually make your root cause worse. once you figure out how to get rid of those things and what to do in place of those things, now you start getting outcomes. Now you start getting results. And now your patients come in and say, why in the hell doesn't every physical therapist, chiropractor, athletic trainer, massage therapist do what you're doing? Because what you're doing is completely different than anything else that I've done, and it works. So after we get through doing that, so we're going to give you modules for 4 months that's going to teach you everything that you need to know to apply critical thinking, anatomy, biomechanics, physiology. Then we're going to bring you here into my clinic for 2.5 days and teach you every manual technique that you need to know. We're going to teach you the thought process behind it, how to apply it, what it means, how to demonstrate it, and how to use it with every single patient that walks in your clinic. No more of this, well, this patient needs this and that patient needs that, and this patient's diagnosis is this and this patient's diagnosis is that. Every single patient that's on this wall behind me and every single patient that's going to walk into your clinic has human physiology, which means the root cause of their problem is the same. So once you understand that, you just streamlined your entire process and got rid of all of the junk in your toolbox that has been sucking you into the broken medical model, which is what physical therapy school and the APTA and insurance companies and everybody else want you to be stuck in. All right? So we're going to do that in 4 months and then 2.5 days here, and your career is going to change. How do I know that? Because I use it every single day. Because the people that I've taught it to use it every single day and start walking away from the broken medical model and even opening their own clinics, because what they're doing flies in the face of everything else that they are doing in the clinic that they are working at. So they figure out, I gotta get out of here because this doesn't make any sense. So now you know what you need to know in order to get out of the situation that you are in. So after you turn this video off, you can no longer blame the education model as the root cause of your problems and keep going the wrong direction. You can blame the education model for all of the problems that it left you, and then you can say, I solved all of those problems. I filled in all of those holes with this one course that cost me a fraction of a fraction of a fraction of what I paid for in time and in money to become a physical therapist, a chiropractor, a massage therapist, an athletic trainer. It's up to you. Don't tell me you can't afford it because you just afforded 6 figures of student debt to get where you're at. My bet is you're going to go on vacation this year, and that vacation is going to be more than it would cost to fix your career. Don't tell me that you don't have time, because if you have an hour a week to dedicate to the modules that you're going to get in the shift, you have plenty of time to go through that information. The only thing that you can blame is yourself for being too comfortable where you're at and not really wanting to get out of the situation that you're in. And as things continue to pile on top of you, and as you continue to reach for straws and go to continuing ed classes that don't fix your problem, and talk to mentors that don't fix your problem, and read articles that don't fix your problem, and review the research that sucks you further into the problem, you only have yourself to blame. So keep blaming the education system for the problems that we have, but solve your problem by taking one step, and that one step is joining the shift. And in 4 months, I guarantee, money back guarantee that you will change your career and you will be doing things that you never thought possible, and your patients will be thanking you every single time you treat them.